Now we have another doctor with us. He's been here before, I think sometime in 2020. That tomorrow was 2020. It's great to have you here with us today, Dr. Douglas Emeka Okor. Did I get it right?
Well,
Consultant neurosurgeon.
Thanks for having me, Thelma.
Reaching us from out of Abuja, from Plateau State, and it says ginger can be incorporated into our meals.
Well, basically, the key thing about primary prevention of any medical problem, be it cancer, be it infections, be it anything at all, we always talk about healthy living, isn't it? Healthy living in terms of the kind of food you eat, whether you do exercises and stuff like that. Ginger. Is ginger healthy? I'm sure it is.
Do you use it in your meals?
I'm not a nutritionist, but yeah, I'm sure there are things that actually eat that actually we spice with ginger and stuff like that. So I'm sure something like ginger actually has medicinal and healthy
implications for us
in it and stuff like that. But saying that ginger probably can be a main constituent for actually prevention of cancer, I think that's overstretching it a little bit.
Okay, thank you. That's good. We've talked about our environment too, that toxins are all around us. And oftentimes, many of us eat processed foods rather than having fresh foods and all that.
Yeah, so basically, if you talk about the things that will predispose or increase the risk of having things like cancers, of course, you talk about environmental factors, isn't it? I think Dr. Al-Hassan Adamu talked about them. The smoke in the air, people having being secondary smokers when they are staying close to people who smoke, alcohol, the kind of additives and especially with canned food and all that. And that's why people always advise, eat natural organic stuff, isn't it? There are toxins everywhere. Everywhere.
We can't avoid them, but we can do the best we can in our own small space.
Thelma, absolutely.
Okay. There's much talk about underlying ailments. And in fact, the latest gist now is that some people, because they already have some diseases that they feel can predispose them to COVID-19, are not going for treatment, especially cancer patients, because it makes them more vulnerable to COVID-19.
True.
And if they do get COVID-19, it can be catastrophic.
True, very, very true. We all know that the COVID-19, in terms of when you look at significant morbidity, i.e. being very, very sick, or fatality, actually dying, that people who have coexisting morbidities or coexisting medical problems are at higher risk of these. Okay, so, but it's a balance, isn't it? It's a balance. People are afraid of going to hospital and all that because, they can contract COVID, or they're afraid that people might say, they have COVID, or some of the issues that are coming up with stigmatization from COVID and all that. But at the same time, still looking after yourself, still looking at primary prevention in terms of people having the knowledge. That's one thing I'm really passionate about. I'm really passionate about actually advocacy and health promotion and providing knowledge for Nigerians. Absolutely important. Okay, and people having the right attitude and the right behavior in terms of looking after themselves is extremely important.
What is the right attitude that we ought to have in terms of
the right attitude? First of all, is that you should know that hey, your body is like your door or your window. It will get worn at some point. Okay, so looking after yourself and trying to slow down that wear and tear process of the body and actually being proactive about your health is extremely important. This issue of God forbid it won't happen to me. Nope, that's not the right attitude. The right attitude is being proactive, is being preemptive, and actually looking after yourself and actually seeking for information. I know what we're doing here now. We're really trying to put the information out there for Nigerians, but I'm saying, hey, Nigerians, be proactive about information. Look after yourself. This issue of going to do checkups every 6 months, every 1 day, it's absolutely important, Thelma. Extremely important. I know that generally, as a people, because of our very poor healthcare system and the poor healthcare indices and the significant problems in terms of the focus of all governments at all levels on healthcare, which is extremely important, that the issue of healthcare is not a mainstream issue in Nigeria.
Well, we're getting there.
Yeah, we'll continue to push, Thelma. We'll continue to push. So we are hoping that the more we continue to push, more Nigerians will understand that, hey, healthcare is important. And of course, one of the problems with healthcare is that it is not cheap at all. Healthcare is not cheap, and that's why this prevention thing that Dr. Al-Hassan Adamu, who was here before me, talked about is extremely vital, extremely important, and something that we need to continue to push for.
because treating any ailment at any time can be financially devastating.
Absolutely.
He also talked about access, availability, and affordability.
Yes,
Three very integral A's.
The 3 A's. Yeah, I talk
This
about that again.
access, yeah, this access. People say they go to hospitals, they have to take card every time, they wait for 2-3 hours. Is that enough reason to deprive yourself of medical expertise?
Well, usually when people ask me questions like this, Thelma, the first question I ask them, I actually throw a question back to them and ask them, have you been to a public hospital before? What was your experience? You also your experience, your journey through the hospital. It is excruciating. It's really painful. You go here, the stress and all that. So imagine you having maybe some pain or weakness or any sort of symptom in your body, and you look at going into that sort of hospital, or you look at going to a pharmacy where you just go in, you pick a drug. I'm telling you, your default setting will be just go to the chemist. Okay, so access is extremely difficult, and like I said, I'll go back to what I said again. One of the major problems we've had for a very long time in Nigeria is that healthcare is not a mainstream socio-political issue. It is not. Okay, and we would have
how can we make that thing easier, coming in and not being made to go 2 hours perambulating before you finally get access to the expert knowledge you desire?
You can only do that when all the key actors understand that healthcare is fundamental, and that we start pushing all the buttons to actually make sure that this thing that we call patient-centered care, where you actually look after the patients, where you actually think of the patient's journey at all levels. Be it at the facility level, be it at the federal ministry of health, you actually think, hey, how can we actually do things in an innovative way, throwing technology and all that, to actually make life easier for people in terms of this access?
It is obvious to me that you don't work in a public hospital.
Well, I do not work in a public hospital.
Have you had a first-hand experience of working in one?
Yes.
Okay.
I trained in Nigeria before I went to the UK. I did my medical school. I actually worked in Nigeria before I left.
Okay, that's good. Prevention is always better than cure, and we cannot overemphasize that. It's because of this that perhaps the House of Reps and the Senate and the Federal Ministry of Health are working, they have a synergy to amend an act that will involve more Nigerians in the Nigerian health insurance, so that also to include more diseases. I did hear for a while that cancer is not included for the most part in the National Health Insurance Scheme, and the people are paying out of pocket. But you have talked about policies and white papers. We've had brilliant ones in the past. What are your thoughts at this time?
Let me tease out something that you just said, Thelma. You talked about these key actors in government actually trying to pull together and work together for healthcare, isn't it? World Cancer Day, 3 days ago, and it's I am and I will. That's the team, isn't it? I am and I will. And basically what they are looking at is cooperation, and how we can actually pull together to actually do stuff. So good job that you have these key actors in the National Assembly and the Federal Ministry of Health trying to pull together to do all this stuff. Fantastic. But the key thing when you look at policies, legislations, look at white papers, we have lots of these things. For example, almost about 2 years plus ago in 2018, the fourth quarter of 2018, the National Cancer Care Plan, which was to help roll out the National Cancer Care Program, was actually launched then by the former Minister of Health, Professor Adewale. And if you look at that document, absolutely fantastic document in terms of looking at how they can actually build a system, looking at things like governance, risk management, how they actually monitor and evaluate all the things that they want to do and stuff. Like, fantastic document. But like, one of the major problems we have in this part of the world is actually how to actually translate those things in those good books, those white papers, those legislation, those policies, actually translate them in real time to actually impact on the lives of Nigeria. And for example, looking at this specifically in cancer in healthcare, how to actually help with early detection, screening, prevention, treatment and management of cancer. Where are we 2 years plus ago? We are still struggling. Is it all doom and gloom? No, it is not. I love that this year that we looked at how we can actually pull together, work together. People like Dr. Al-Hassan and his group, the Nigerian Cancer Society, they keep pushing. We cannot give up. Giving up is not that's one of the things I always say, Thelma. Giving up is actually not an option. We continue to push. We have fundamental issues in our healthcare system, and the COVID-19 just actually exposed it. But it has always been there, but COVID-19 just exposed the deficiencies and the weaknesses within the system. Despite these deficiencies, weaknesses, and gaps within our healthcare system, when you look at the 3 A's that you talked about before in terms of the availability, affordability, and accessibility of care, thank God, at least in 2021, the private healthcare sector has done a fantastic job in terms of availability. There are many, even in cancer cases, that will normally go abroad, go to India and stuff, okay? You have the capacity in Nigeria, but when you actually jump to look at things like affordability and accessibility, we are struggling. A significant number of Nigerians, more than 70%, cannot access that sort of care in the private hospital. It's extremely expensive, but still cheaper than going abroad. But it's extremely expensive. And so when we start thinking of strategies of how to actually move forward, we think about innovative ways. For example, the PPP. Look at the model, for example, in the NISA-LUTH collaboration, which is the Nigerian Sovereign Investment Authority. They collaborated with LUTH, with Lagos University Teaching Hospital, and they have a fantastic cancer center there with all the machines and delivering at least some level of standard of care. Okay, so for example, that place, I will say that, hey, that place is one of the best. I won't say the best, but at least one of the best in terms of providing care. So that sort of public-private partnership, looking at innovative ways, throwing in technology, trying to do some sort of strategic funding and all that. Those things are really important, and we need to really start pushing governments at all levels and all key stakeholders to really start actually really focusing on healthcare. It's so important. I wish I could actually kneel and actually beg them. Because one of the things I always say is that the Nigerian patients are worth it. When I got to UK, the first thing I noticed that, hey, the National Health Service, they are really keen about providing healthcare and providing the best for their people. And the first thing that came to my mind is, okay, I'm a Nigerian. Nigerians are worth good healthcare. So I came up with that mantra, the Nigerian patients are worth it. Thelma, the Nigerian patients are worth it.
Thank you. That's brilliant. That's fantastic. It's inspiring. It's motivating. And also, it should make us do all we can to continue to imbibe great lifestyle practices.
Absolutely.
But we do hope, yes, partnerships are integral, especially for funding and to make access, availability, and affordability no longer an issue for many Nigerians. Just like our last conversation, this one has been so enlightening. You talk with so much inspiration, vigor, and vibrance. Thank you for coming today on Weekend Deal, Dr. Douglas Emeka Okor.
Thank you.
How am I sitting? Am I sitting well? To ensure my spine is okay?
Well, you're looking good now.
No, I didn't say look, sitting. I'm worried about my spine.
In terms of your sitting position.
Okay. Thank you, Dr. Okor.
Thank you so
Great
much.
to have you have this chat with us on Weekend Deal.